So this is our webinar on lupus and COVID-19, an open forum for questions and answers. I'm Margaret Smith. I'm the manager of the Lupus and APS Center of Excellence at Hospital for Special Surgery, and I'm joined by my colleagues in the Department of Social Work Programs SLE workshop and giving you a warm welcome today. Our goal with this program is to give you information, accurate information to the best that's currently available so that you can manage with confidence and calm living life with lupus in the midst of a pandemic. So I'd like to introduce our workshop participants today, my fellow panelists, Dr. Peggy Crow and Dr. Jane Salmon. Dr. Crow is the physician-in-chief at Hospital for Special Surgery. She is the head of the Department of Medicine and the Department of Rheumatology. She's also a professor of medicine at Weill Cornell Medical College, and she heads the autoimmunity and inflammatory program. That's what it is, at Hospital for Special Surgery. Dr. Jane Salmon is the Colette Keene Research Chair at Hospital for Special Surgery. She's an attending physician in the Department of Rheumatology at HSS, and she's a professor of medicine and an associate dean at Weill Cornell Medical College, and she is the director of the Lupus and APS Center of Excellence. Both of these doctors have made seminal contributions to research in the causes of lupus and the causes of flares, and in targeting treatment candidates for the treatment and cure of lupus. They're in fact lionesses in the world of lupus research and care, and I am so fortunate I get to work with them every day, and I'm so happy that you get to meet them on this panel. So I know that both of them would like to say a few words of greeting to you before we start our questions, so I will cede the screen to Dr. Crow.
Thank you very much, Margaret. We're so happy that you could all be with us here today. This has been a tremendously challenging time. For the last, I don't know how long it's been, 6 or 7 weeks, our lives have been changed. For those of us in the healthcare world, there have been tremendous changes. At our hospital, we've transformed from a rheumatology and orthopedic hospital to a hospital that takes care of patients with COVID-19 and takes care of our lupus patients in a very different way, often by telehealth visits. We know that this has been a difficult time for you, that you have many questions. We've been hearing from some of you over the last few weeks, and we're very happy to try our best to answer some of your questions today. Jane?
Welcome. Oh, I'm not.
Yes, go ahead. Go ahead.
Okay. I want to welcome all of you and thank you for your interest in participating in this program. We recognize that it's been challenging, as Peggy said, for everyone, but I think having to live with a chronic disease like lupus, other perturbations are even more impactful and even more difficult. And I hope that by the end of today, you're more comfortable in navigating your lives with lupus and dealing with COVID, and you can develop a sense of wellness and a sense of confidence on how you move forward and transition from COVID to non-COVID with your lupus.
Great, thank you. Okay, so let's move into the question portion of our presentation here. So many of you sent in your questions about lupus and COVID-19 ahead of time, and we thank you for that. And really some themes emerged from what you were interested in, including the symptoms and the course of COVID-19 disease in lupus, and managing life during this pandemic, and also going back to normal. You know, when and how and why can we do that? Also questions about medication, certainly hydroxychloroquine and other aspects of managing. So we're going to work through those thematic groups of questions now. We'll start with some that have been sent to us, and certainly if you have a question that you want to ask, go down to that bottom bar, press the Q&A button, and then you can input your question and we will pick that up as we go. Okay, let's get started. So Dr. Crow, we have a question. Are individuals with lupus at higher risk for developing severe symptoms of COVID-19?
That's a really important question. And, before the epidemic even hit us full force, I think many of us, particularly rheumatologists as well as patients, had that question in our heads. And my answer is that we don't have the answer yet. But what I can tell you is that at our institution and with the collaboration of academic centers throughout the world, there is an important effort to answer that question, to get the data, to be able to understand, do patients with lupus or other autoimmune diseases, rheumatic diseases, do differently? Do they do worse? Do they do better than perfectly healthy people? What I can tell you is that this is a very infectious virus, and people who are in tip-top health can readily become infected with it, as can lupus patients or anyone, I believe. But your question really relates to severity, and I think we really need to wait for the data to come out to understand if lupus patients are at greater risk of having severe disease.
Have we seen any higher fatality rates amongst lupus patients? Has that been tracked yet in any registries?
It is being tracked. Jane, do you want to?
Yeah, I don't think we have the data. The registry Peggy's talking about is actually a very exciting global initiative where rheumatologists throughout the world are looking at their databases, looking at patients hospitalized with COVID and seeing if they also have any rheumatic disease. So we will be able to answer some of those questions for lupus, for rheumatoid arthritis, and we'll be able to look at the effects of the drugs the patients are on, because all of that is being recorded. And we are part of that, but the fact that the global community has come together will enable us to learn a great deal. Rheumatic diseases, particularly like lupus, are not common, so you need cooperative efforts to answer these questions.
Great. So does being on immunosuppressive drugs for lupus increase the risk of developing severe COVID-19?
I think that intuitively, we know that patients whose immune system is suppressed with drugs or with HIV, for example, they're more likely to get infections. But again, we don't know which particular drugs make you more vulnerable than others, or whether the kinds of doses that most lupus patients get, some of which are fairly low, have an impact at all. And these registries will teach us, will give us the answers to those questions.
Great. Okay, thank you. So what sort of recovery time is there for COVID-19 with lupus patients, and how do you know that you've cleared it?
I think that we have to recognize that the severity of COVID-19, the disease, is so variable from person to person. As I'm sure you've heard on the news, there are people who become infected who aren't even aware of the fact that they're infected. And then we're also very aware that some individuals, very unfortunately, do very, very poorly. They develop severe disease. Now, what we're learning from tracking, for example, the patients at New York Presbyterian Hospital, our partner hospital, they've been generating very nice data on the patients they've seen, and they've seen many, is that it's older people, it's patients with underlying significant chronic diseases such as heart disease, lung disease, hypertension, diabetes, even obesity, who are among those who have the most severe manifestations of disease. And some don't recover, and those who do recover are going to have a very long period, I think, of getting back to health. Those who develop much less severe manifestations of disease, maybe like a very severe flu, I think still have told us that they can be quite fatigued for a number of weeks. I'm not sure that we know that that's any different in lupus patients from those who don't have lupus. So the answer is that it's very variable, but certainly the infection can be debilitating and take a while for people to get back to good health and feeling good.
And I think the definition of recovery is largely a clinical definition. One can think about testing to prove that you're virus negative, but in fact, those tests aren't perfect. And if you have dead virus remaining, your test may be positive even if you're not contagious and you're fairly well. So the definition of recovery is no fever, no respiratory symptoms, and feeling well for a number of days, or at least no respiratory symptoms for a number of days. And I think what's interesting from a scientific standpoint in terms of COVID, as Peggy described, there's tremendous heterogeneity or differences in how severe the manifestations are. And that's a little bit like lupus. Some of you have worse manifestations than others of you on this webinar. So if we learn why some people have more severe COVID than others, it may inform us about why some people with lupus have mild disease, whereas others have more severe organ manifestations.
Great, thank you. So here's a question from one of our listeners out there. So are people with lupus more likely to experience a cytokine storm? And if so, should we or our loved ones ask the attending ER physician to test immediately for serologic markers and treat early with biologics?
Oh, cytokine storm is a fascinating topic that I've become very immersed in myself, because some of the features of cytokine storm are so reminiscent of immune system alterations that lupus patients experience, sometimes rheumatoid arthritis patients. The definition of cytokine storm is a little bit fuzzy. It's a situation where the immune system becomes very activated, and some of the cytokines, the molecules that the immune system makes, are overexpressed. That has been documented in some patients with COVID-19. But exactly how to diagnose cytokine storm is not a clear-cut issue. There are some laboratory markers. One might be ferritin that can be an indication of cytokine storm. Some of the cytokines, IL-1, IL-6, perhaps others, can be measured, but usually the results don't come back immediately. So what I would say with regard to that question, if a patient is sick and ends up in the emergency room, I'm not sure that it's so easy at that early point to make a determination whether cytokine storm is a factor in the disease in that person. But it's something to be very, very carefully watched for. And I think what's very interesting now is that there is a lot of discussion about whether some of the so-called biologic drugs that are used in patients with rheumatic disease might be helpful in those COVID-19 patients who do develop cytokine storm.
Thank you. Okay, and kind of in the converse, so are people who have been exposed to COVID-19 more likely to develop autoimmune disease?
That's a fantastically interesting question. And I think probably for the past 40 years, people have been looking for the so-called infectious trigger of autoimmunity. And we haven't found it, but we do have a feeling that there may be a relationship with viruses. I would not expect that most people with COVID are going to get autoimmunity. They won't. People with flu don't all get autoimmunity either, but there may be a very small subset. And there's actually an investigator at special surgery who's following looking at a large database of patients with COVID and following them over the next 5 years to see whether, in fact, there looks like there's a signal. So we don't know. It's probably not terribly likely, but it's a really interesting question.
And, I'll just add to extend what Jane and I said, is that what's very clear is that COVID-19 is not just a viral infection. It's a viral infection that's accompanied by a very interesting immune response. So COVID-19 and autoimmune diseases have in common a very active involvement of the immune system.
Here's a question. I'm going to direct this to Dr. Salmon because this is really her area of expertise. So this participant says, I have SLE and just learned that I'm pregnant. Congratulations. Am I at higher risk? Any additional precautions I should take?
Typically, women who are pregnant have a blunted immune response because we have to welcome the fetus who's foreign. So our ability to detect invaders may be a little bit suppressed. And in some viral infections like H1N1 and influenza, it's very important to be vaccinated so that you don't get severe viral manifestations. There aren't a lot of data about COVID right now. There are some studies from Asia that suggest that there's no increased risk and in fact argue that effects to the fetus are negligible. There are rare cases of the baby being affected at all. I would recommend that all of the precautions that are recommended generally be adhered to in a hypervigilant way if you're pregnant, but I don't think we have evidence yet that pregnant people have worse disease. I would just be really careful. Social distancing and all of the hand washing and so on.
Thank you. So another question from a current attendee here listening. Doctors are now seeing healthy people with COVID-19 develop antiphospholipid antibodies and severe life-threatening clotting. Is a lupus patient with these antibodies at high risk for this complication?
So that's another area that's of great interest to me. And before I address the question, because I'm not going to have a definite answer to the question, what's interesting again about COVID is it, in a way, has features, just like we talked about the immune system being activated. Well, the vasculature is inflamed. All of your blood vessels, the lining cells of your blood vessels get activated by your immune system. And when the lining of your blood vessels get activated, and because of inflammation, they're more likely to induce clots. And patients with COVID, one of the manifestations of severe COVID, not a common one, but certainly seen, is blood clots in your lung, blood clots in the small vessels in your skin. So it's very similar to antiphospholipid antibodies, and a small subset of the patients who get these clots actually have antiphospholipid antibodies. There's evidence that viruses can drive antiphospholipid antibodies in some situations. So I don't really know. I think anyone with an antiphospholipid antibody is more likely to clot, but I don't think it affects your likelihood or your vulnerability to COVID.
Great.
And just any patient who's had clots or very severe COVID, they're actually treated with blood thinners like the kinds of drugs that patients with antiphospholipid antibodies who have clots are treated with. So we're handling them the same way to prevent clots.
Thank you. All right, we're going to go back to pregnancy for a moment. So Dr. Salmon, you're still on. I'm 6 weeks postpartum. Do you have any specific comments on postpartum flare risks in patients with COVID-19?
Well, postpartum flare risks for patients without COVID-19 are not really higher than a non-pregnant person. And again, we don't know whether COVID triggers flares, but I wouldn't be particularly concerned. I would again be careful because you don't want to infect yourself or your child. I would assume that you got tested because in many maternity units, before they admit the patient for labor and to labor and delivery, they get tested, and if the test is positive, they test the baby.
Great, thank you. All right, Dr. Crow, what about herd immunity with COVID-19? Since there's no vaccine, what do you think about that?
Herd immunity is a feature of the population once an infectious disease has interacted with enough of the population such that it's much less likely that it will infect others. Herd immunity takes a while to develop and is very dependent on how many people have been exposed to the virus and have generated an immune response. I think it is pretty clear that at this point in time, there is not sufficient herd immunity to assume that that kind of concept is applicable to any of us for a while. I think that at some point in time, we hope that this virus will not be a factor in any of our health concerns, but I think for the foreseeable future, the virus is around, it's infectious, and we're all very anxious to follow the development of vaccines and hope that an effective vaccine can be developed. So herd immunity is something that we hope will happen over time, but I don't think it's anything we can depend on over the next few months or this year.
Okay, thank you. Another question that a reader sent in. I'm currently not taking any medications for my lupus. Am I still considered to have a compromised immune system or be at high risk?
Well, let's see. I think that every lupus patient is an individual, and it's very difficult for either Jane or I to comment on your immune system. I think that lupus patients do have altered immune responses, and that can affect, as Jane was saying earlier, your susceptibility to getting a viral infection or other infections. How long after stopping your medications you have an altered immune system really depends on your individual way that you have your lupus and how it's affecting you. So I think very hard to answer. Lupus on its own, though, in the absence of taking any medications, is associated with alterations in immune function.
Okay, thank you.
I'd underscore what Peggy said. Your immune system is different. Whether it will respond worse to a particular infection isn't clear, but medications can affect it. It's important that you don't just stop your medication because you think that you want to protect yourself.
Great, thank you. All right, let's switch our gears a little bit here and talk about managing life during COVID-19. Okay, so is it better to order in things you need, like groceries, or go to the store in terms of infection exposure?
Well, maybe we can each answer that. I've been ordering in, and I think Jane has been going to the store. I'm not aware of any scientific studies to compare the two, but I think it probably very much depends on where you live. I'm right now in the middle of Manhattan in New York City, the epicenter of COVID-19 around the world. And, I live in a busy neighborhood, and to be honest, I have not left my apartment in probably 5 weeks. I haven't stepped outside on the sidewalk. So I'm having food delivered, and I'm wiping off the containers when they're delivered. I think really the overall message is please be careful. Please follow the guidance of your community, your state, your country, but err on the conservative side, the safe side, and you really want to avoid opportunities to be exposed to the virus. But Jane's doing it a little differently.
Not so differently. I'm outside of New York. I was in the middle of Manhattan where Peggy is, but my family and I moved to a place where we can't have everything delivered. We get some deliveries, but once a week we go to the supermarket. We're wearing our masks. We're wearing gloves. We stand 6 feet apart waiting to get into the supermarket. The supermarket lets in very few people at a time. We get out as quickly as we can. We wipe off everything before it gets in the house, and we'll sometimes even wash our clothes when we get into the house. So we do that about once a week. That's the big outing. So it really all depends on what's available to you. And if you have to leave your home, do it as carefully as you can, and don't bring whatever exposure you may have had into your home. It's important to wear your mask and wear it properly.
So is being in a more densely populated area more dangerous, more risky to your health than being in a less densely populated area?
Well, if you stay in your house the way Peggy is, you're safe. The more people you're exposed to, the more contacts, the more opportunities you have to get exposure to a person who's infected. So limiting exposure is the key, no matter how dense the area is that you live. We can't always change that.
I think we make assumptions to explain, for example, why New York City has been so terribly, dramatically affected by this infection. And, I think my assumption is that it relates to the density of the population. It's, one of the most dense cities, certainly in the United States, and maybe in the world. And also, we are a hub for international travel. We have JFK, we have Newark Airport, and the New York Times has done very interesting studies tracking how infected individuals have traveled around the world and spread this virus. So, I think both density and access to international travel have been very important factors that have contributed to certain locations being particularly affected by the virus.
Wuhan similarly was a hub, an airport hub in China.
Yeah. What are the recommendations on dental appointments and regular physician appointments during this time of pandemic?
Well, I mentioned just very briefly as we were introducing ourselves that the approach to healthcare has dramatically changed in the last 2 months. We at Hospital for Special Surgery are managing most of our patients, most of our lupus patients, via telehealth, meaning at a distance. Some patients are being managed by the telephone, but we do make available physicians, rheumatologists every day should a patient become really acutely ill, experience a very significant flare. So, the judgment about whether it's most wise to receive care through telehealth or a phone call versus actually coming in face-to-face to see a doctor is a discussion between you and your physician. So it is possible to be seen, but we really advise, as long as this epidemic is so active and that there is risk of infection, that you use good judgment in collaboration with your physician if you think you need to be seen in person.
And the same thing for dental care. Any routine dental care, anything that's not truly an emergency should be postponed.
Okay, thank you. Here's a question that someone wrote into us. I think it just crystallizes the sense of concern and confusion as to how do we manage. So the question really is, how do I mitigate my exposure but not live like a hermit?
Well, I think Jane and I both answered in a way as we were discussing how we get food. I am living like a hermit. I'm living by myself in my apartment, and to be honest, I'm okay with it. Perhaps that's because we're all working very, very hard, as pre-COVID. because we have had so many changes in, as I was just saying, how we deliver healthcare, how our hospital is operating, how we've been thinking about research opportunities and challenges. So the fact that there is a lot of work to do, a lot to learn from this infection, there is just constant communication, digital communication with our colleagues and people around the world. So we may have to, in effect, live like a hermit for a while, but there's so much opportunity to connect. And for those of you who, don't work or, don't have responsibilities that need to be taken care of via digital approaches, still, it's very important to be in touch with your family and your friends, and there are many, many good ways to do that. And I think it's very important.
Okay, thank you. All right, let's talk about return to normal, return to new normal, return to whatever, back to the human race. How should I determine if it's safe for me to socialize again? And do I need to take precautions other than those that other people are taking, and for how long?
So I think we have to listen to our government leaders, to the CDC and the expert panels, and these may be different regionally based on the prevalence of infection. Lupus patients probably should be a little more careful, but I would expect that as the data show a decrease in the prevalence, we will slowly, in a very staged way, rejoin the world. That will probably include masks for some long period of time. It will probably include social distancing. You won't sit elbow to elbow with your colleagues or at the Starbucks. But that should be, from an administrative standpoint, mandated, I would hope, in a reasonable way. And I would urge you to adhere to the rules even more rigorously than the average person.
And what about dating?
I'm a little older, so I don't know about dating via social media, but I think that's a good start, to date via social media till you feel comfortable and permitted to actually meet in the 3D. That's my conservative advice, to at least try that out.
Okay, all right. Now, when social distancing starts to lift, do you think people with lupus should continue to work from home?
I think Jane really answered that, or responded to that issue. I think we all, including lupus patients, really need to be very vigilant and respond to the instructions we're hearing from our governments. But as she said, I think lupus patients can be a little more conservative, a little more careful, and I think we're going to be following those guidelines, wearing masks, social distancing for quite a while, actually, and that's going to apply to lupus patients as well as others.
And I would add that wiping surfaces and washing hands, maybe not wearing gloves all the time, but certainly wiping surfaces and washing your hands regularly is are very important maneuvers to protect yourself.
So taking it, to the kind of a logical end, should a lupus patient remain in quarantine until a treatment or a vaccine is developed?
I don't think so. That could be a very long time. And, I think there will be there'll be a gradual, bit by bit loosening of the restrictions that we're currently under. And, I think it's always a risk-benefit negotiation. And, I hope that in not too long a time, we'll begin to be able to venture outside and get back into the real world a bit.
And it's unlikely that there'll be a vaccine with evidence that it's truly effective for over a year. year and a half. And Peggy's very happy 5 weeks, but I don't think she could live a year and a half in her apartment. And I wouldn't recommend that the rest of you imagine the next year and a half totally quarantined. I think protective interactions are feasible.
That is a hopeful message. Thank you. Okay, so how should I determine when it is safe to travel abroad again? And should I bring extra medication?
I'm not sure that we have the specific answer to that. I think it all is along the same lines, that we have to follow the recommendations of our governments. We have to be careful. And, you know, personally, I have no intention to travel abroad for quite a while until we have a much better sense of the trajectory of this epidemic and, you know, how it's slowing down and the degree of risk there is in exposing ourselves to others.
I mean, we're assuming that as we're on the other side of the mountain, as is common terminology, that we're going to stay in a downtrend. And if some of the public health initiatives are loosened up too quickly, there's the possibility of another surge. So we have to watch this carefully, both in our regions, in our country, and globally before any decisions are made to travel.
Okay. All right, let us again switch our gears a little bit and talk about medications and then focus on hydroxychloroquine, Plaquenil. All right, so one of our participants today has written in and says, should I start immunosuppressive drugs? I've been on lupus medications, I'm supposed to start something for RA. Should I start what was foreseen for me to start as an immunosuppressive drug this time?
I think the answer is always that you need to partner with your physician, rheumatologist, presumably, in making those decisions. I mean, you know, if you are staying safe, not exposing yourselves to others who are infected, and you are not yet infected with this virus, you know, I think there is every possibility that you can just focus on your lupus and the best medications that you know, seem right for you in collaboration with your physician. So, you know, I think that's a very individual issue that needs to be negotiated with your rheumatologist.
And that negotiation, the risk benefit Peggy was talking about, really deals with what organs are threatened, what manifestations you have that are dangerous versus what the risk is if you practice all of the public health that's recommended.
Okay. So if a person misses medication like Benlysta, say they've been on Benlysta and they miss it for a while because they became ill with COVID-19, is it safe to resume taking the medication?
I think that's, again, a discussion with your rheumatologist. And, you know, this infection plays out in an individual way with everyone. If you have been symptomatic, you've been documented to have the infection, you're feeling better. Jane really addressed it earlier. You know, if you've gotten through it, I think that, and you're feeling back to your pre-infection self, I see no reason why, you know, you shouldn't be on your typical medications. And if your disease warrants Benlysta treatment, then it makes good sense to me. But again, you know, you're an individual and you need to discuss your own specific situation with your rheumatologist to see if this is the right time to resume it.
Okay, great. All right, switching gears again, we're going to talk about specifically Plaquenil or hydroxychloroquine, which has been so much in the news. So a basic question, does Plaquenil seem to lessen the severity of COVID-19?
Well, we can even give a try at that, but what I would say is I have not seen any data to support that Plaquenil lessens the severity of COVID-19.
And I agree with Peggy. There are no data that it either prevents disease or lessens disease. There are trials addressing those specific questions, randomized trials, not retrospective data, but retrospective data from the VA in the United States, big studies, the biggest study, argue that there's no evidence that hydroxychloroquine has a major role as a treatment for COVID-19.
Okay. Would being on Plaquenil, as a baseline for lupus therapy, help me to not get COVID-19, especially if you've been on it for a long time?
I mean, Jane just answered that, no, as far as we know, but maybe I can elaborate a little bit on some of the thinking going back a couple of months ago when the epidemic started. And it is very true that some hospitals, some physicians caring for people who became infected with COVID-19 thought that it might be helpful in, if not preventing the disease, at least minimizing some of the symptoms. So clearly, patients have been treated with the drug. Some of the thinking behind that goes back to laboratory studies. There has been a great interest in identifying a so-called antiviral drug, a drug that would actually diminish the capacity of the coronavirus that is involved in COVID-19 in being able to infect cells and to expand in cells in the body. And the way those kinds of studies are done are in the laboratory. Different drugs are tested with cells and the virus, and what's looked for is, is one drug better than another, or is there any effect at all in inhibiting that infectivity of the virus? And there are some data to suggest that hydroxychloroquine or chloroquine have some modest effect on diminishing the infectivity of cells by the virus. But that in no way reflects what might happen in a body. The response to any virus is very complicated and involves the immune system interacting with the virus and cells in the body. And so, I think that there was reason to think, well, let's at least consider that Plaquenil might be a drug that could have antiviral activity. But that was really just based on laboratory studies, not good data from studying patients.
And I think we'll have stronger data from studying patients, both from the trials and from this international rheumatology global collaboration, because we'll know which lupus patients were on hydroxychloroquine and which rheumatoid arthritis patients were on the drug and who wasn't. So we will be able to answer that question in a more reasonable way. It made sense to try it. It's a pretty safe drug, but so far it doesn't look like it has a major effect.
Okay. Is there anything that we lupus patients can do to ensure our supply of Plaquenil? And what do I do if I can't get a refill? Should I stretch out my pills?
Well, maybe Jane can address that.
I'd like to take the second part of the question first, and that is that the studies that showed that Plaquenil, that hydroxychloroquine is effective in keeping lupus quiescent and limiting flares, showed that if you have the flares that occurred when the patients stopped drug in these studies were many weeks after stopping the drug. So the drug stays in your body for quite a while. So if you can't get it for a few weeks, you're probably okay. So I wouldn't panic. I think with more and more evidence that hydroxychloroquine is not so beneficial, and with fewer new cases, there won't be as much difficulty getting hydroxychloroquine for patients who need it for lupus and not COVID. And I know there are efforts from the American College of Rheumatology and from EULAR, the European rheumatologist, to try to have pharmacists and governments allocate hydroxychloroquine for patients who need it for their rheumatic diseases.
Is there something else that I can take besides Plaquenil or hydroxychloroquine?
This goes back to the same point. You know, you need to discuss your medical regimen with your rheumatologist. There are many drugs that lupus patients take that can be helpful, and you know, those of you listening are I'm sure well aware of some of those. And those medications could, if really needed, be started or juggled with doses modified. You know, I think probably all of you are well aware of steroids and prednisone. Steroids, while you know, not a drug that we really favor having patients on over many years, can be helpful in the short term if it's really necessary. But you know, I think our overall message is that the buzz about Plaquenil as a potential therapy to prevent or treat COVID-19 is kind of dying down. And, you know, we really are very hopeful that lupus patients who do benefit from Plaquenil will be able to get the drug. But, you know, if for some reason there's a problem with that, again, just discuss with your rheumatologist, and there are other ways of managing your disease in the short term.
Okay. All right, let's turn to some questions about research. So which research studies are going on so obviously there are hydroxychloroquine studies, and then there are other compounds, other agents. So Dr. Crow, could you address that broad topic?
Yes, you know, it's been so fascinating for those of us who are immunologists to be learning about COVID-19 and how the immune system is so important, both probably in helping to limit the severity of the disease. And what I'm referring to there is type 1 interferon, which may be important early on in getting control of the infection, but also with regard to what we talked about earlier, cytokine storm and some of the very pro-inflammatory mediators that can contribute to some of the severe manifestations of disease. So there are controlled clinical trials that have been proposed, and some of them ongoing around the world for some of these agents. Examples might be a drug called tocilizumab, which inhibits the IL-6 receptor. This is, IL-6 is a cytokine that has been implicated in cytokine storm. So that drug, as well as another IL-6 inhibitor called sarilumab, and there may be others, are being tested both formally and informally in clinical trials around the world. There are inhibitors of another cytokine, interleukin-1, IL-1, that are there's a trial in Italy. I'm not aware of an active controlled trial in the United States. But these drugs are, you know, being tried selectively, and it'll be very interesting to see if there are hints that inhibiting this cytokine storm with anti-cytokine drugs might be helpful. Now, there are also the registries that Jane mentioned. There are the large registries, the more local registries, and there are what are called, let's call them big data studies, collaborating with insurance companies to use what's called claims data on, you know, patients who've been seen by physicians or who've been prescribed drugs, to, in an analytic way, try to hone in on some of the risk factors as well as protective medications or damaging medications, on the other hand, for people who develop COVID-19. So lots of research. I think the most exciting opportunities are really the lab basic science research to try to have access to cells, blood usually from patients with COVID-19 infection, and to understand through different kinds of tests, assays in the lab, how the immune system in the COVID-19 patients is both similar and different from patients with autoimmune and inflammatory diseases.
And an additional way to, in a very elegant way, to address some of these questions is they're collecting data now over time of healthcare workers who are caring for patients, so they can follow healthcare workers who might get infected to see the very earliest stages of infection, looking at blood markers and blood cells, which you couldn't really see once you come to the emergency room, or once you get sick. So we'll really be able to understand the natural history of disease, both from big data, from laboratory data at the bench, looking at samples, and from the clinical trials. The trials are going to be trials, many of them are placebo controlled. So we'll be able to look at the differences in the biology of the patients who get the drug and who don't get the drug, and who respond and who don't respond. So I think we'll learn a lot about COVID, but as Peggy said, there's some similarities between viral infection and lupus. So some of our lessons about COVID will be able to be applied to lupus, both for understanding mechanisms of immune dysregulation in lupus and considering development of interesting new targets.
So one of our attendees asked the question now, if you've had COVID-19 and recovered, do you have immunity from getting it again? Do we know if you do, how long? What about that question?
I mean, it's a new disease and we don't know. We hope you do. There are trials using plasma containing antibodies from patients who've had COVID and giving them to patients who are seriously ill with COVID, with the idea that these antibodies are neutralizing the virus and will be therapeutic. We're not sure. There are some case series from abroad that has an impact. We're not sure how long the immunity lasts or whether it's protective. If it's like most other viruses, it's probably protective.
What about the development of a vaccine, which is kind of our holy grail? We can all come out from under the rocks if we have a vaccine. So, Dr. Crow?
Well, very quickly after the nucleotide sequence of this virus was determined, and it happened really very, very quickly, laboratories across the world jumped on it and began developing, what was needed to develop a vaccine. I know the NIH, National Institutes of Health, have worked very hard on this, but as have other centers around the world. So there are already candidate vaccines that are being tested. But going back to what Jane was just saying about immunity, potential protection after having the infection, I think similarly, the nature of the immunity that develops in the context of a vaccine is very important to understand. So just because you develop antibodies doesn't 100% mean that they are protective antibodies. So I think that the study and the development of a vaccine is going to happen in several stages. You develop by understanding the virus itself, what might be a good immunogen, and you test that to see if it induces an immune response, an antibody response. But then it has to be looked at as well for whether that antibody response really prevents you from developing the infection. So it's a process. And, I think that what has been so remarkable is the speed and commitment and dedication with which scientists all over the world have jumped on this very, very important need. With a lot of transparency, I'll say. Every day there are new data that are put out on the internet for anyone to look at. And that's not the way science usually works. And it's, I think, been very, very helpful to moving the science as fast as humanly possible.
So I'll take a final question, which is kind of a philosophical question, but I think it really draws together everything that we've talked about. Will the government and the research community realize how helpful lupus research has been and therefore add more funding toward future lupus research?
We really hope so. I think just the whole identifying chloroquine hydroxychloroquine and chloroquine as a potential therapeutic highlights the scientific depth of the lupus community and what it can bring to bear to infectious diseases. The type 1 interferon story was very much a story that Peggy's lab and others' labs have developed in the context of lupus. We have no commitments, but certainly we're on everyone's radar. So I'm hoping that funding will come from it, but certainly knowledge will. And if our goal is to advance knowledge, the knowledge we gain from COVID clearly will impact on understanding lupus.
I couldn't agree more. You know, this has been a traumatic but really wonderful opportunity to learn. You know, we've immersed ourselves in understanding COVID-19, and in doing so, you know, there are just all of these lessons to be learned in both directions. What do we learn about lupus from COVID-19 and vice versa? So I can't speak to funding opportunities that might come from this that are focused on lupus and benefit lupus patients, but we can all hope so.
So I'm sorry to say we've come to the end of our hour that flew by. We had so many questions. I'm sorry we couldn't get to every single question. I hope you feel that you derived benefit from this and that you did have certain of your questions answered and you got more of a sense of control, of comfort over how you propose to manage living with lupus in the midst of a pandemic. So very shortly, you'll be getting an email with a link to a survey. We hope that you'll take the 5 minutes required to fill it out. It's very helpful to us, as I said, for us to fulfill our community benefit mission and help provide programming and information and resources to each of you. We have recorded the program, and so it will be available shortly. It'll have a little light editing, and then we'll post it on our webpage. We'll post the link to it on our webpage, which is hss.edu/lupus center. And on that website, you have a lot of patient-facing resources, articles, many things for you to look at, and we invite you to do so. We also love hearing from you. So if you'd like to send us a message, you can email us at lupusapscenter@hss.edu. We hope that you'll tune in with us again sometime in the future for another program. And in the meantime, we wish you health, we wish you safety, and thanks so much for being with us today. Bye-bye.